Hi, this is Jim Broselow, and I'm honored to receive the ISMP's Lifetime Achievement Award. The following clips are a preview of some of the things I'll be saying during the awards ceremony.
This may surprise you, especially if you're not a physician or nurse, but this is standard of care. If you went into our best hospitals and you had an acute emergency with yourself or your children, people would be doing the math like this on a bed sheet. Scary. Is that right? Is it the right equation? Do they have the right thing in the numerator? Did they do the math right? You say, well, how about a calculator? But every time I do something, maybe I'm in a hurry, but I go to do my checkbook and I push total and I get 0 and I know that's not right. I was adding, I was subtracting. Oh gee, I didn't cancel the entry before. So the use of a calculator itself can introduce just common everyday errors. So when we talk about removing the math from medicine, yeah, that's our goal. We want to remove the math from medicine, and that's our goal with Artemis. We're talking about the whole process. How do you set up the equation? What is the difference in the equation with a neonate, a newborn that needs a certain medicine versus an adult person? How much fluids can they have? Is it diluted? How fast do you give it? And so this is a really daunting process. In fact, I'm not sure we would have done it if we knew how complicated it was going to be. You're reading a vial, you're getting older. You have bifocals or trifocals. It says, one says 3 milligram per 2 mil, but for your calculation, you have to make sure you get the 1 milligram for 1 mil. You don't want to confuse the fact that it says 2 grams, but it's not per milliliter, it's in the whole vial. These numbers, the way it's set up, the visuals, they are all part of the process and they're all very error prone. Our language is horribly confusing. We don't talk in words. If I wanted to talk in words, I'd say go in the other room or make me dinner. But in medicine, we don't do that. We talk in numbers. The patient's on 3 micrograms. Well, actually, we mean 3 micrograms per kilogram of weight. And we give it 3 micrograms per kilogram per weight, but you have to set the pump for mils per hour. And this product is not labeled milligrams, it's labeled in 1 to 10,000 dilution, and then you have to know how many milligrams or micrograms. The language is ridiculous. So those of you that are medical will kind of understand this. If I were using computer order entry the way it's set up in a hospital, but I was using it in an Italian restaurant, and I order to the chef that I want lasagna, and I did it with computer order entry. He would see, oh, I can read Dr. Broselow's writing, that's good. He's not allergic to cheese. He's not on 2 veal dishes. And it is dinner time, it's the right time. So I think I'll make it. So that's computer order entry. It checked that. But the problem is, somebody has to make the lasagna. There's the lasagna. There's our nurse. But don't worry, we always get it right. What do I mean by that? We don't keep track of the recipe. And the chart says that what you ordered is what we gave. We don't know that it is. And so it's the process that is the issue. And the process is totally dependent on error-producing mechanism. We all know it. We would never allow people to do math if something important was at stake. So think about this. When lives are on the line, we do math. When money's on the line, we barcode.